Hello everyone, my name is Dr. Omi Narang. I'm a retired family physician with some surgical experience in the past. My video shows how to make a clinical mask, which I hope will be better than not wearing a mask or wearing a bandana in a clinical setting. The authorities have been struggling to supply adequate protective equipment in the current corona crisis. Therefore, we have to step up and do our part and be the good Samaritans. Cut the J cloth as per the template. It comes folded like that in the pack that I used, and note it is 2 layers. Insert filter cut to size from pleated MERV 13 home filter between the 2 layers of J cloth. In this case, Filtrete MERV 13 Ultra Allergen was used, which filters out virus particles. As per their literature, it is made of safe plastic fibers and is non-toxic. Fold the edges of J-cloth on the sides and hold it in place with pins. Please note that the top of the J-cloth is wider and needs to be double folded as shown, and again to be held in place with pins. I'm just finishing the sides now as shown in the video. Make sure that the piece lies flat. What you are seeing now is the top of the J cloth, which is folded twice. And this again is going to be retained in place using the pins. The next step would be to stitch the edges, starting with sides first and then the bottom. The top edge will be stitched close to the edge, leaving some redundant flap which will be used to incorporate a twist tie or plastic boning material. This will be used to adjust the nose bridge. The plastic boning material is preferable to a twist tie. I'm about to finish the top edge on the sewing machine. The next step is to place a twist tie along the top edge, making sure about its location. And right now you're watching a partial slit being cut at the top in the redundant flap, and the twist tie is being inserted between the layers and adjusted. As I mentioned earlier, the plastic bone material is preferable to this twist tie for the nose bridge. The next step is to stitch the elastic loop. It is 1/8 inch braided plastic, and this is attached to the corners, doing 1-inch tucks along the length as shown, and it is stitched in place using the sewing machine as shown. All 4 corners of the mask have to be dealt in a similar fashion. The braided plastic loops have to be incorporated. There are 2 of them, one on each side, with the ends being incorporated in the tucks as shown. You can see here the braided loop. One corner has been done and the other corner is being done right now. All the 4 corners will require reinforcement stitch diagonal to the corner. This will ensure that the braided loop is secure. Now you can see the mask as it is, with the loops, with the outer surface on the top, and what you are looking at is the inside surface. There's a nose bridge utilizing twist tie or preferably plastic bone material. You can notice the tucks at the 4 corners incorporating the plastic loops. We are turning the mask inside out, and we will be doing the dart tuck in the middle of the bottom edge of the mask as shown. Similarly, we have to do the dart tucks on the sides. These tucks are very important to get a good fit under the chin and also on the sides of the cheeks when the mask is put on. This is what it looks like. The mask is again inside out and folded into halves to apply the tucks on the sides. The dart tuck is being applied on one of the sides now as you are watching this part of the video. The tucks are approximately just under an inch. This is what the mask looks like from the outside. You can see the tuck at the bottom and tuck on the sides. This gives the mask a shape which molds around the face, around the nose and the chin and on the sides. What's being pointed out is the nose bridge, which is adjustable. That's the bottom tuck, and you can see the tucks on both sides. This is what the mask looks like on the inside. I'm attempting here to adjust the nose bridge. And the sewing process is done when the mask is worn. So that's the twist tie that you watched just now. And that's the bottom edge of the mask. That's the side tuck with the elastic loop incorporated with the tucks at the corners. So the final product as it looks. Make sure that the elastic loops are secure by tugging at them. The mask is ready to be tried. I'm putting the loops around my ears. I'm adjusting the nose bridge, making sure that it fits correctly. That's the loop around the ears, which is comfortable. Again, the loop's length can be adjusted. Those are the two sides of the mask which seem to fit very well. The chin also fits quite nicely. Now this is a clinical mask with MERV 13 filter incorporated between the two layers of J cloth. And I think this is going to be clinically more useful. This is the final picture of a regular surgical mask and also the mask that I demonstrated how it can be made and can be safely used in the clinical environment. I sincerely hope that this is going to help in the current crisis. Please feel free to share this information and support making of this mask for use in a clinical setting. I would also like to point out that this mask has not been tested, but it certainly is better than having no mask or wearing a bandana in the clinical setting. Thank you for watching.